Well, COVID-19 can have devastating physical effects, as we know, but the pandemic can also greatly impact our mental health, even for those who don't test positive.
And that figure's to only get worse as the pandemic continues, and many people have to deal with their seasonal affective disorder. Dr. Ritu Bhatnagar is a psychiatrist with UnityPoint Health Meriter, and she joins us now to talk about this. Welcome to Live at 4, Doctor.
Thank you so much for having me.
So we enter this time of the year when things tend to start to get a little cloudy and gloomy, and is this kind of when you start to see maybe some of your patients dealing with seasonal affective disorder?
Absolutely. And actually, we are all probably noticing it with daylight savings being finished here, that we wake up when it's dark. We sometimes leave work when it's dark. We barely see the day. It seems like the sun is sometimes hiding behind those gray, cloudy skies. And so it becomes a big challenge. I know during residency for me, I had a big struggle with it myself, and my vitamin D levels plummeted. I wasn't seeing my family much either, and it was really, really hard. And I found myself getting quite depressed during that time. And I'm glad that I had my family to help me notice that things were not going like they understood me to be. And so they helped me look for some help myself. So I think that from a lived experience helped me understand too that this is not something that is just in somebody making it up. It is actually a real thing that happens in the winter, in particular at this latitude, and with the grayer days. So it is something. Yep, go ahead.
I'm sorry, I didn't mean to interrupt you. Go ahead.
Oh, I was just saying that is something that if people start noticing these signs, for me, it was that I was exhausted all the time. I was basically turning into a bear, kind of hibernating, getting more irritable, wanting to eat a lot of carbs, like a whole bag of potato chips, for instance, things like that, which, is an unusual thing. For me, it was. And so my family started to notice these things, and it was something that helped me realize this is more than just the winter blues. It is something that needs a little bit more help.
But how does it contribute to the stress and anxiety that people are already feeling because of the pandemic? It's sort of the perfect storm, isn't it?
Absolutely. Yeah. The challenge is that a lot of things that in the wintertime that people use in past years when there was no pandemic to help kind of have something to look forward to and to enjoy the time together, for instance, family gatherings, vacations to sunny destinations, all of these things are now severely curtailed by the restrictions imposed by the pandemic, and people are appropriately being more careful about how they choose to travel and how they choose to gather. But it has really changed the quality of our celebrations. We're not able to be outdoors with people as much as we'd like. Now it's getting colder. So all of these things really do make that, as you said, the perfect storm, and make it really hard for people to kind of keep their head above water.
So what do you tell your patients? I mean, is it obviously eating right is really important? What about, being able to exercise, maybe get outside even as it gets cold?
Yeah, so, there's something else that I discovered that I was really ecstatic about, and that was called the light box or light therapy, which, our brains are very, very acutely sensitive to the seasonal changes, and some people are just more susceptible to it than others. I'm going to do a little demonstration since I have it here, and it's called a light box. It's a 10,000 lux light box, so very bright light. I'm just going to turn it on for a second because I don't want to overwhelm the Zoom light sensitivity here, but it's literally a very, very bright light, and you just sit in front of it for working up from 5 minutes in the morning up to 15 to 20 minutes every morning during the winter, and the effects of it simulate sunlight without having the UV radiation. And so what that does is it resets the brain and makes it think that the days are actually longer, and if you're sensitive to those seasonal effects, it can basically work similar in efficacy to an antidepressant.
Well, so many challenges people face this time of the year. Doctor, thank you so much for your assistance with this today. I really appreciate you joining us.
Absolutely.
Thank you,
and if
Doctor.
people are not able to use that light box, then you can certainly enjoy some exercise, spend time with your family, make sure you're getting your vitamin D, and just enjoy the sunshine every day as much as you can.
As long as we can. Thank you once again, Doctor. Appreciate it.